With the introductory material behind us, Chapter 3 will examine the management of an EMS safety program. Once completed with this module, you should be able to articulate the concepts of a safety program, recognize the importance of a safety program, describe the key components of an insurance program, and describe the process of conducting a job hazard analysis. Here is a situation you hope to never have to deal with. One of your rigs is involved in a fatal collision. You responded to plenty of fatal crashes in your career, but never one involving your own service. You are less concerned about the management of the incident itself and can only imagine how this incident will impact the organization long after the incident is resolved. Some of your questions include: what insurance coverage is provided for this type of incident? What will be the impact on the organization? How is the community going to respond? At this point, you wish you had more information on the eventual repercussions of this incident. As a reminder from the previous chapters, an EMS safety officer's goals are to reduce accidents, injuries, illnesses, and their related costs to the organization. To accomplish these goals, it is important for the EMS safety officer to have a professional, working relationship with the agency's management. As far as management of the organization is concerned, there are typically numerous management processes that lend themselves to improvement with the goal of improving safety within the organization. Safety is everyone's responsibility, and a true culture of safety begins with management. This means that there must be a reporting structure for safety concerns and recognized hazards, plus a mechanism to address them with accountability measures to ensure they are mitigated appropriately. If an incident does occur, it is vital for a prompt and thorough investigation to be conducted with an eye on preventing future similar incidents. Part of this management buy-in and recognition of just how important safety is to an organization are efforts to maintain a safety perspective in all aspects of routine and not-so-routine operations. An incident commander, for instance, not only commands the strategy and tactics at the scene of an incident, but must also be mindful of the safety for everyone involved in that incident. Ensuring a quality, sustainable safety and health program requires a systems thinking approach. This means the program must recognize the different components of various operations within the EMS organization, how these components interface with each other, and how they can work together to prevent injuries and illnesses in the workplace. Essentially, all parts are interconnected, with each one affecting the other. The chain is truly only as strong as its weakest link, and a flaw in one piece will more than likely impact all the other pieces, which then impacts the system as a whole. For instance, wearing appropriate PPE on calls is great, but it loses effectiveness if the ambulance is not decontaminated after the run. Have you ever seen someone use an electronic device for completing a patient care report while wearing the same gloves he or she used for patient care? After the patient is gone and the EMS provider is completing the report on the same device, does he or she wipe the device down with disinfecting wipes first? If not, cross-contamination is likely. The risk is even more pronounced when the provider takes the device into a workroom and decides to have a bite to eat while working on the report. Another example would be having a driving policy without ever having any driver training. The benefits of having a policy are undermined by not training personnel on that policy. Again, a culture of safety within an EMS organization begins at the top. Management must demonstrate leadership in fostering a culture of safety by providing adequate resources, ample motivation, recognizing safety as a priority, and ensuring accountability for safety at all times. By fostering a culture of safety from the top down, management increases personnel protection from unwarranted risk, reduces costs associated with potential losses, and improves morale by showing genuine care for the organization's employees or members. These proactive measures are important not just because they are the right thing to do for your personnel, but there is also a financial benefit, as it has been noted by the textbook author that for every $1 saved on direct costs such as medical or insurance compensation, an additional $5 to $50 more is saved on indirect costs such as repair to equipment and retraining new workers. Ensuring safety is not only ethical, it is a good, responsible business decision. While a culture of safety must begin with an organization's senior leadership, management is not solely responsible for health and safety within an organization. Ultimately, safety is everyone's responsibility. An EMS safety officer is just one person who may not be able to see, recognize, prevent, or mitigate all health and safety risks. EMS provider safety and health is a team sport, so to speak. It cannot be overemphasized that a strong safety and health program begins with an organization's leadership and managers. OSHA has a voluntary protection program available for use by various industrial work sites, and those participating have reported lost workday cases 60% to 80% lower than average. Within these various programs are common threads for success. These include providing visible top management leadership and involvement, the establishment of safety goals and objectives along with a safety and health policy, providing adequate authority and responsibility to those responsible for safety initiatives, ensuring responsibility is actually assigned to someone, ensuring all personnel are involved in safety initiatives, and ensuring accountability for management, supervisors, and virtually everyone else within the organization. Assignment of responsibility means that everyone involved in maintaining a safe workplace is denoted as such. As everyone within an EMS agency should be involved in maintaining a safe workplace in some fashion, it is important that management reaffirm those expectations to employees. Within the scope of an individual's responsibility to manage safety and health risks, he or she must also be empowered with the authority to do something about these risks within his or her respective sphere of influence and control. This delegation of responsibility and authority must also be accompanied with accountability. This means not only coaching or disciplining those who fail in their responsibilities to maintain a safe workplace, but also recognizing those who are doing a good job. It is always better to reward good behavior than to try and correct bad behavior after the fact. From a management perspective, maintaining that accountability could potentially involve passing the financial repercussions onto those who failed in their responsibilities. If your EMS agency is large, individual stations or units may have their own budgets, and taking money from a sub-unit's budget as opposed to simply paying for a loss out of the service's larger budget may provide enough of a penalty to dissuade unsafe, arrogant, flippant, or apathetic behavior. The textbook author actually suggests that individual providers be held financially responsible for losses if they are at fault. Rather than trying to rule with an iron fist by punishing bad behavior, it is often better to reward good behavior and coach individuals to modify behavior when necessary. Such efforts require that your organization have clear safety goals for everyone to understand and internalize. Conducting safety activities such as a hazard hunt, safety training sessions, or safety fairs can also help instill a culture of safety within your organization's fabric. Your safety and health program should be evaluated on a periodic basis to ensure it is effective. This program evaluation should not only identify accomplishments and the strong points of your safety and health program, but it should also identify weaknesses and areas where improvements can be made. This data will define your opportunities for further improving the safety, health, and wellness of your employees. Unfortunately, if the evaluation is not conducted appropriately, you may miss significant opportunities or misdiagnose a perceived problem. Tables 3.1 and 3.2 in the textbook list common obstacles that can impede the effectiveness of a safety and health program evaluation. The first table, 3.1, addresses obstacles at the supervisor level. Supervisors who begin the process with any of these potential barriers in mind can have a significant negative impact on the process. Luckily, the table also provides potential solutions to these obstacles. Some of these solutions may take time to implement. For instance, building trust does not occur overnight. Ironically enough, the overall success of a safety and health program can depend on the strengths and weaknesses of management in general. If the rank and file within the organization do not have trust in the organization's leadership, that can be a difficult problem to fix. Table 3.2 addresses obstacles from the perspective of non-managers. As with the previous table, potential solutions to these common obstacles are provided as well. Please feel free to pause this presentation or refer to your textbook to review these two tables in greater detail. Strategic planning is important for any organization to develop or reaffirm its mission, vision, values, and goals. The strategic map gives an overview of how these strategic planning components will be implemented within the organization. One of the challenges in strategic planning, especially for an emergency response agency such as a fire department or EMS agency, is the tendency to delve into tactics. The goal of strategic planning and mapping is to take a proverbial 40,000-foot view of the organization, define the overall direction and goals for the organization, Save the tactics and how to reach those goals for another discussion. Your strategic map should describe the processes that need to be implemented in order to successfully pursue desired changes for achieving your short and long-term goals. While strategic planning is a leadership topic discussed in a different course, it is important to make sure safety, health, and wellness are a part of the organization's strategic plan. The EMS agency's strategic plan establishes a roadmap for the future, and workplace safety, health, and wellness is a vital component of the plan to foster a culture of safety. With this in mind, we will now focus on specific steps for implementing your agency's safety, health, and wellness strategic plan. In implementing your strategic safety, health, and wellness map, it is important to ensure buy-in from top levels of leadership and management within the organization. This buy-in must be nurtured at other levels within the organization as well by involving others in the process. It is important to be transparent and work on developing trust within the agency. Conduct self-assessments and benchmarking. If you are not already training on the components within the strategic map, then start to do so. Otherwise, continue that training with changes as necessary that reflect the updated strategic plan. One way to develop buy-in and nurture trust is to have a safety, health, and wellness steering committee comprised of different people in different roles within the organization to serve as a process owner for a particular strategic initiative. Safety, health, and wellness policies should be developed or updated as necessary, and they must be aligned throughout the organization, meaning the processes are consistent and followed throughout the organization. Specific roles and responsibilities should be defined for everyone within the agency, which also requires the development of an accountability system to ensure the organization's safety, health, and wellness initiatives are being followed. It is beneficial to create ways to reward participation. All personnel should be trained on new initiatives or changes, and those changes should then be implemented across the organization. When discussing organizational change, it is important to utilize continuous quality improvement principles to measure the performance of the new initiatives, communicate results, make course corrections when necessary, and celebrate successes. Some organizational changes are easier or more difficult than others, so it will be important to not only monitor your organization's progress, but to also provide support where it is needed. This support includes reinforcement, feedback, reassessment, mid-course corrections, and ongoing training to personnel. Part of an effective safety, health, and wellness program is to identify the hazards potentially faced by your employees. In simple terms, a hazard is a potential for harm. Evaluated further, a hazard is often associated with a condition or activity that, if left uncontrolled, has the potential to result in injury, illness, or even death. In addressing hazards within an organization, there are 3 activities that should be conducted. The first is a job hazard analysis. The second is to actually identify the work hazards that exist. And the third is to correct or prevent the hazards whenever and wherever possible. While it is easy to think about the hazards faced by EMS responders in the field, it is also important to identify and address hazards in other less innocuous settings, such as the station, corporate offices, or even hospitals. A job hazard analysis is a technique that focuses on the relationship between personnel, the tasks they perform, the tools they have available, and their work environment to ultimately identify workplace hazards. In performing a job hazard analysis, it is important to involve all personnel that may be impacted by potential hazards within the specific environment under review. Take a look at previous accidents and incidents. As the saying goes, those who do not know their history are doomed to repeat it. Previous accidents can be important learning tools in a job hazard analysis. You should also conduct interviews with your personnel. They are usually very familiar with the hazards they face in the workplace and may be able to identify some that you may have missed. With all that information, develop a list of hazards faced by your personnel, weigh the likelihood of each particular risk with the reasonable outcome of failing to control that risk, and rank the hazards on the list to develop priorities for reducing hazards across the organization. Are there any hazards that are pervasive and carry significant risk to your personnel? If so, then those hazards must be addressed first. Hazards that are infrequent and carry very little risk may be prioritized lower. Part of conducting a job hazard analysis may involve a work study. This means watching the employee perform job tasks or steps objectively. The purpose is not to evaluate the employee on performance, but to objectively document the individual steps within a larger task to identify those specific steps that have the most inherent hazard. For example, starting an IV may be the overall task, but there are numerous steps that must be conducted. Opening the start kit, for instance, is one step that has very little risk. Performing the actual venipuncture, however, has a lot more risk for both the provider as well as the patient, given the use of sharps and blood-borne pathogen concerns. While identifying workplace hazards is considered a separate step from a job hazard analysis, it is also inherent within a job hazard analysis. It is important to ask questions and dig deeper to evaluate workplace practices, environmental issues, and other sources of potential hazards to your personnel. Be a detective. Collect data and evidence. Be objective. As difficult as it may be, avoid preconceived notions and do not minimize others' opinions simply because they do not correlate with your own experiences or thoughts. If necessary, review the textbook for a list of probing questions to ask, beginning on page 31. Some hazards are easy to identify, such as those associated with functioning at a motor vehicle collision. Vehicular traffic, broken glass, hazardous materials, blood-borne pathogens, and other similar elements probably come to mind right away. Do not let familiarity with an environment or a specific type of response cloud your judgment, however. Emerging technologies such as battery packs in hybrid vehicles and compressed air cylinders for side airbag systems can be easily overlooked or forgotten in your analysis, along with other roadway hazards such as nearby power lines, ice, uneven surfaces, and embankments. Part of a work study involves breaking down the individual steps within an overall task. Here's an example of the steps within the task of moving a patient down a set of stairs with a stair chair. Do you agree with these steps? Without being too granular, are there more steps, or do you think these are adequate for the purpose of identifying hazards associated with the task? Feel free to pause the presentation on this slide or take a look at figure 3.5 in the textbook on page 32. What steps do you think have the greatest inherent hazards? Here is a sample job analysis form. You can also find it on page 33 of the text. While there are others available, this one does a fairly good job of including the highlights by noting the job location, the task being performed, a description of the potential hazards, and the controls that can be utilized to reduce or eliminate exposure to the risks associated with the hazards. Lastly, once your hazards have been identified, it is time to develop a plan for reducing or eliminating the hazard. Keep in mind that not all hazards can be eliminated. For instance, paramedics must start IVs in the field. It is not reasonable to eliminate all risks associated with starting IVs in the field by simply eliminating the practice of starting IVs. Just because a hazard cannot be eliminated, however, does not mean the risks associated with that hazard cannot be reduced. When enacting changes to address hazards, industrial hygienists utilize one of two controls to minimize risk. The first type of control is the preferred type of control in that it removes the component of human error. These are called engineering controls. Referring back to our IV example, there is a recognized hazard when performing a venipuncture. There is even more risk immediately after the needle is removed, as the sharps is now contaminated. An example of an engineering control to address this sharps concern is a retracting needle. Even better yet are the needles that engage a safety over the tip once the needle is removed from the catheter. Work practice controls, on the other hand, deal specifically with the steps a worker takes to complete a task. Such a control would be the requirement that sharps are immediately placed into an approved sharps container once the venipuncture is completed. This is as opposed to setting the needle down somewhere or sticking it into a seat cushion, which used to happen a lot before retractable needles became commonplace. Another work practice control is to prohibit the practice of recapping needles, bending needles, or reaching into a sharps container. Once corrective actions are identified, employees must be adequately trained on the new policies or protocols. It may also be necessary to train more than once on the new practice. It was mentioned earlier in this presentation, but bears to be repeated. Studies show that the ratio of indirect costs to direct costs varies widely from a high of 20:1 to a low of 1:1. OSHA states that the lower the direct cost of an accident, the higher the ratio of indirect to direct costs. Invariably, the more accidents that occur in a workplace, the higher the cost to the employer, both in increased insurance premiums and greater indirect costs. Be sure to keep in mind as well that there is typically also a price paid in personnel, health, and wellness. While the financial costs of a back injury, for instance, are significant to the employer, the repercussions of that back injury to the employee can be debilitating and life-altering. Part of the direct costs incurred by a workplace incident are related to insurance premiums. Workers' compensation is just one piece of the puzzle, as EMS leaders must also be cognizant of liability for damages caused by the agency and its employees to third parties such as patients or members of the public. Workers' compensation is limited in its scope of coverage to those considered employees of the organization. Different insurance must be maintained to protect the EMS agency against fiscal losses associated with damages to patients or the public. As pointed out by the textbook author, the origins of insurance can be found in the form of family, friends, and communities coming together to rebuild after natural disasters. By pooling funds, a group of people can spread risk among those within the group and ensure protection against loss for members of the group, assuming that they are not all hit with devastating losses at the same time. By having a lot of people or entities in such a group, the group is able to tolerate numerous losses at once. In paying insurance premiums, you are buying a promise that the insurance company will cover your losses as defined within your policy if something bad occurs. On the other hand, if you do not need to file a claim, you must still pay your premiums to continue your coverage and enjoy the benefits of spreading your risk out across those who also pay premiums to the same insurance company. Unless you have more money than you know what to do with, purchasing insurance for various reasons is usually a very wise move, as the premiums are typically small compared to the cost of a loss. For instance, if your station is destroyed by a natural disaster, having good insurance coverage aids in your recovery. Without insurance, the full financial burden to recover from the disaster falls on the agency, which may not be able to afford such a loss. This concept of spreading risk across a community of people is very common and can take many forms. The Amish, for instance, will work together to replace the barn of another following its destruction in a disaster. The implied promise for those who help is that if they suffered the same fate, the community would help them out in the same fashion. Philadelphia is also utilized by the textbook author as an example of how fire insurance developed over time. The Union Fire Company organized a mutual insurance company back in 1750 to assist individuals whose residences were destroyed by fire. Within Wisconsin, there is actually a statewide fund that utilizes money collected by insurance companies for fire insurance premiums to help fund fire department training and fire prevention activities. There are insurance companies out there willing to cover all kinds of risks. Insuring emergency service entities is a specialty for many companies, such as the Volunteer Firemen's Insurance Services, which was founded by Arthur Gladfelter in 1969 to provide better support for the emergency services industry than existed at the time. There are other insurance companies that now specialize in insuring emergency service organizations, and many of their roots can be traced back to the efforts of Mr. Gladfelter. There are numerous insurance companies today that provide protection against all different types of risk. When evaluating insurance companies, the first thing to research is the lines of insurance they offer. Personal lines are insurance policies that cover an individual person's home, auto, or life. Commercial lines, on the other hand, are designed to insure businesses against losses such as errors in emissions, theft, vehicle collisions, or other liabilities. EMS agencies need to explore options for commercial lines, while individual EMS providers should check into personal lines of insurance coverage. When shopping for insurance, it is important to work with an agent and company familiar with your specific type of risk. Auto, home, and life personal lines are somewhat commonplace. Finding a commercial lines agent or company familiar with the business of EMS can be a little more challenging. It can also be difficult to compare companies and insurance products, as they can vary based upon the coverage provided, limits to that coverage, deductibles that must be paid by the insured to cover a portion of a loss, and the premium paid for the insurance coverage. There is also an option to self-insure against a loss, meaning the business maintains a fund to cover the financial impact of various types of losses. Given the financial resources typically necessary to self-insure, This practice is typically seen only with large corporations or municipalities. For most EMS agencies, self-insuring is not an option because the organization does not have the cash flow necessary to cover a significant loss. This means the agency must find an insurance company or companies able to provide insurance for property, vehicles, equipment, medical malpractice, errors and omissions, workers' compensation, and other potential liabilities. Insurance has evolved significantly over time, and it is important for EMS leaders and managers to understand how insurance works, the benefits of having insurance, and the shortfalls also associated with insurance. First and foremost, there is no need for insurance if there is no risk of loss. Stated inversely, a risk exposure is any condition or situation that presents a possibility of financial loss, whether or not an actual loss ever occurs. It is the existence of a loss exposure that serves as the impetus for needing insurance. Within our modern society, there is typically more than one type of loss exposure faced by people and business entities that requires multiple types of different insurance coverage. A typical EMS agency, for instance, faces potential financial losses associated with a natural disaster that can damage or destroy property, motor vehicle collisions involving ambulances and other service-owned vehicles, liability for injuries suffered by other people while on the agency's property, medical malpractice errors or negligence on the part of service employees, and so on. When evaluating potential loss exposures, it is not enough to calculate the simple direct cost associated with the loss, but the EMS leader or manager must consider the costs associated with conducting investigations, negotiations, legal defenses, court appeals, attorney fees, and other soft costs. One of the benefits of having insurance is that, in many instances, these indirect costs are included within the insurance coverage. For instance, if the agency is sued for medical malpractice or for a motor vehicle collision involving an agency ambulance, the insurance company will pay for the legal defense as well as pay the financial damages to the plaintiff. Many insurance companies also provide risk management services for their insured, as the insurance company has a vested interest in minimizing risk and preventing claims in the first place. The width and breadth of these types of services can vary considerably between different insurance carriers, so be sure to weigh your options carefully when selecting an insurance company to meet your needs. Having insurance does come with some drawbacks. The first is the financial burden of maintaining insurance. While some may consider insurance to be a necessary evil, if you never have a claim, you may not see much value for the premiums you are paying on a regular basis. Depending on the type of coverage and the cost associated with it, going without a claim for a considerable period of time may result in paying more money for the insurance policy than if you had self-insured and paid for a loss out of pocket. If your particular hazard has a bad history, you may be required to pay higher premiums even if you do not have the same negative history of the hazard in your experience. Consider a teenage driver, for instance. Premiums for teenage drivers are commonly much higher than they are for their parents due to the higher risk of automobile collisions for that age group in general, regardless of how safe your son or daughter may be behind the wheel. Generally speaking, the insurance premiums are well worth cost considering the potential for losses associated with the risk being insured. The cost of the premiums is still a drawback, however. Adverse selection is another problem where you may wind up paying more for your premiums because others covered by the same insurer have suffered significant losses. Remember, insurance is a way of distinguishing risk, which means you are paying premiums to not only cover your risk, but the risks faced by other policyholders as well. Another drawback is that some individuals are less careful, so to speak, knowing that they are protected by insurance. Insurance also cannot turn back the hands of time or magically heal people who have been injured by a covered event. Insurance companies must also weigh the risks they are willing to insure across the number of people or entities insured. The more people or entities an insurance company insures, the more resources it typically has to pay claims as they arise. If there are too many losses that occur simultaneously, however, it may prove too much to bear for an insurance company. As a result, there are some hazards for which insurance companies simply refuse to offer policies. Flood insurance, for instance, is only available if certain criteria exist. This means that you may have trouble finding someone to insure your company against an unusual or significant risk. Insurance also cannot solve every problem. While an insurance policy may pay money for injuries, damages, or even a death, That money cannot return people to perfect health or undo a fatal incident. This can be said for losses that occur both internal and external to the organization. Having a death within the organization can have devastating repercussions to the EMS agency. A similar death to a member of the public can negatively impact the EMS agency in an entirely different fashion. Suffering losses will typically impact future premiums, and the emotional impact of some losses can have negative long-term effects on the organization. While insurance provides financial resources given a loss, it cannot immediately replace buildings or equipment that is damaged or destroyed. Organizational leaders must still make contingency plans to ensure continuity of operations if something catastrophic were to happen, such as the loss of a building, ambulances, or even personnel. Consider the vast resources associated with a city such as New York, and then think of the losses suffered by the fire department on a single day back in 2001. All the insurance coverage in the world could not immediately replace all the apparatus and firefighters who were lost on that day. Given a small service with only 1 or 2 ambulances, it would not take much for even a somewhat minor incident to significantly impact operations. As an EMS leader and manager, it will be your job to assess your risk, attempt to manage it, and also have a plan to mitigate losses if they do occur. So, given a fatal collision involving one of your ambulances, what do? One of your first calls should be to your insurance carrier. Work with authorities to conduct an accident investigation. Assemble a team to manage the fallout from the accident, which also means controlling the release of information through a single point. If a fatality was one of your employees, how will you notify the family, hopefully before they find out on the local news? How do you protect the organization from bad press and an erosion of public support? Is it possible to ensure your services are not interrupted by the loss of an ambulance or personnel? These are all considerations for you as the leader of an EMS organization to keep in mind. Now that this module is completed, you should be able to describe at least 3 management processes that are ripe for improvement within your own organization, list at least 3 objectives management should have when establishing a loss control program, describe the implementation process for a strategic map for change and continuous improvement in a safety and health program following the step-by-step approach discussed within the textbook, explain the rationale of insurance, complete a job hazard analysis for your agency based upon an identified hazard, and compare and contrast at least 2 benefits and 2 drawbacks of insurance for your organization.